Hello students, in this presentation we will talk about the experiment of B Pharmacy 6th semester, determination of acute eye irritation or corrosion of test substance. In this experiment we will talk about what are the various thing that is what are the various steps that we will perform throughout the experiment. So the requirement for this experiment, we require the healthy matured rabbit and a drug that is buprenorphine at a specific dose and 0.5% proparacaine hydrochloride as anesthetics and at an analgesic buprenorphine we will use. And we will also use the test substance, the substance which we will use to check out whether that substance is irritant for the eye or not. So in this experiment, the one eye we will treat as to administer as a test sample, and we will compare this eye with the let's suppose if we consider left eye for administrating the test sample, then we will compare this left eye to the right eye, and the right eye we will treat as the control group. So in this experiment of, as I earlier talked about the skin irritation test, and now we are talking about the eye irritation test. Both tests initially done by Food and Drug Administration toxicologist, that is John H. Draize. That's why this test also called as Draize test. So in this test we will administer a test substance to the one eye, and we will check whether this substance is responsible for causing the harmful effect or works as an irritant, and we will check these parameters based on the whether the substance is responsible for causing corneal ulcer or opacity of iris or inflammation in the iris or the conjunctiva's parameter. So one by one we will talk about initially we'll talk about the procedure. In the procedure, first we will add the buprenorphine, that is as analgesic we will use 0.01 milligram per kg subcutaneously, and after administrating of buprenorphine, after 60 minutes we will add 1 to 2 drop of 0.5% of proparacaine hydrochloride, right, as an anesthetics. And after this administration of anesthetic, after 5 minutes we will add a test substance. Administration of the test substance will be through a pouch technique. Pouch techniques suggest to make a pouch under eyelid and put a drop on the pouch, not directly on eye. So this inhibit the loss of drug also. This technique also inhibit the loss of drug. And after that, if any pain persists, we can also add analgesia as rescue dose up to 8 hours if pain persists. After that we will observe and grade the lesions. Let's suppose we will and after that up to the 24 hours we will observe and grade the lesions, and we will terminate our experiment if pain persists. And after 24 hours, 48 hours and 72 hours we will inspect both the eyes and evaluate the presence of inflammation of iris, conjunctiva, opacity of cornea and ulceration. So this will be the normal procedure. And after that, let's suppose after the administration of test substance in the left eye, we will compare the right eye. This is the right eye and this is the left eye. This diagram or images I took from the Xform series software. This indicating the left eye in the this part, this side has the inflammation on the iris, and the conjunctiva, which is also called the pink eyes, this conjunctiva after administration of test substance, and opacity of the cornea already has been changed, and ulceration is also present in the left eye. So all these inflammation in the iris, conjunctiva, opacity of the cornea and ulceration denotes that the test substance that we added in the left eye works as an irritant, because irritant has capability to induce these issues in the eye. So what we have, how we will prepare the observation table for this test. As we are looking in the for 20 after 24 hours we are evaluating the lesions or lesions on the eye, and after 48 hours day 2, and after 72 hours. So in the control eye that we use here for control purpose, right eye, there is no on day first there is no reaction. So we can say that in the control eye the substance we will add it is a non-toxic. In the test eye, like we have seen from the first day up to the end, there is a presence of ulceration, opacity of cornea, inflammation of iris, and conjunctiva, right? So we can say here it is inflammation of iris, right? Inflammation of iris or inflammation of conjunctiva. So in this all 3 days continuously after adding test substance, we can see the lesions in the eye as shown in this diagram. So in the conclusion, we can say after the comparison of ocular lesion in between left and right eye, after application of test substance indicate the toxic effect or irritation effect of the drugs. So we have to write in the result the presence of corneal ulcer, opacity of cornea, inflammation of iris, and conjunctiva denotes test substance is a eye irritant. And at the last we will discuss about the questions that student must know after completion of this experiment. That student must know the examples of eye irritants, what is the function of buprenorphine, why we are using proparacaine hydrochloride, and also student must have a clear cut idea about the anatomy of eye and different part of eyes and their role. So this is all about this experiment, the information that I gathered from these references. So this is all about the determination of acute eye irritation corrosion of test substance. Thank you very much.